Hello, welcome to this episode of the REBT Advocates with Dr. Michael R. Adelstein of 3minutetherapy.com. You can find his book, 3-Minute Therapy, Change Your Thinking, Change Your Life at therebt.life. Links below. And me, I'm Tommy Bateman. I'm a counselor in Virginia, licensed professional counselor. Hey, that's a thing we're going to be talking about today. And today we kind of have a mismatch. We're going to talk about medical doctors, the relationship to psychotherapy. Because, Michael, you had a recent thing happen. So why don't you take it away?
Okay, I'm Dr. Michael Edelstein. I have 40 years experience helping people with REBT, rational emotive behavior therapy, which is the subject of our REBT advocates. And you can find my practice and my 3-minute therapy book in the description below. And Tommy's referring to a discussion I had with an MD who didn't really know the difference between what a psychotherapist is and a psychiatrist and a psychologist, etc. So we're here to clarify that.
Yeah.
Now, the general term is psychotherapist, a person who treats emotional and behavioral problems is normally called a psychotherapist and does psychotherapy. And then there are psychotherapists in various specialties.
Yeah. So Michael and I are both psychotherapists, even though our credentials are different.
And even if one of us had an MD degree, if we help people with emotional and behavioral problems, we would be psychotherapists.
Just like Dr. David Burns, MD. That's right.
And so let's go through the various levels. And the one who has the most schooling is normally the psychiatrist. And the psychiatrist has an MD degree and can prescribe medication. And in most states, none of these other psychotherapists are legally permitted to, although there might be one state where they are, Arizona possibly, a psychologist can prescribe medication. And the psychologist, so the psychiatrist can do therapy and also prescribes medication. A psychologist would only do therapy for emotional and behavioral problems and not prescribe medication. Now, there are different types of psychologists, so I was just referring to one, and that was a clinical psychologist. But there are forensic psychologists, school, organizational, experimental, developmental, educational, many types of psychologists. But I'm a clinical psychologist, and it's clinical psychologists that help people with these problems, usually in a clinical practice.
And typically they're licensed by the state. So they'll have LCP, licensed clinical psychologist, as their acronym or credentials behind their name. It's like PhD, LCP, or something like that.
Yes. An interesting thing about that, Tommy, is that if you have a PhD, then it's called a doctor of philosophy, typically. And then sometimes you're addressed as doctor, and people confuse that. They think if you're addressed as doctor, that means you're an MD, but not necessarily. You can be a doctor of jurisprudence, which means a lawyer, or a PhD in economics and many other subjects.
Absolutely.
And then we have marriage and family therapists, especially on the West Coast, and they also do therapy, but they, as similarly as with clinical psychologists, they're not legally permitted to prescribe medicine.
Yeah. And there's a difference in their education and how they approach it. And then, of course, when you get to my degree, the counseling degree, I'll explain it a little bit further too. But marriage and family, they study things like family systems therapy. For example, Salvador Minuchin did structural family therapy, and that looks very different than REBT in many ways. But that's kind of the approach they take, thanks to the system in relations between people, and that's kind of their focus and study. So you may find that useful as well.
Yes, and Some real examples of the difference between MDs and PhDs who do REBT is Albert Ellis, who just had a PhD. He didn't have a medical degree. And then there's Aaron Beck, who devised cognitive behavior therapy. At first, he called it cognitive therapy, and he had an MD degree plus did psychotherapy. Then also there are social workers, and social workers do psychotherapy, help people with emotional behavioral problems. They also do other things. They often work as a liaison with the community. When I was in working at a mental hospital, I was a social worker, and I helped people transition from the hospital to the community by contacting various community organizations
Yeah.
to help them.
Yeah. In
Uh,
fact, I do that right now in my day job as well, where though I'm a licensed counselor, I function as a social worker and I can be called a social worker, but that doesn't mean I'm a licensed clinical social worker who does the psychotherapy. So that's, I know where all these things get confusing, but licensed clinical social workers, they can bill Medicaid and Medicare and are often more accepted by the Veterans Affairs, even though counselors and LMFTs and of course psychologists were already in there, are getting a bigger presence in there. But social workers, LCSWs, have kind of a macro focus. They don't get taught counseling theory or techniques similar to REBT or CBT quite as heavily as Michael and I would. However, and I'll get into the difference between counselors and psychologists here in a second, but I'm sorry to interrupt you, Michael.
yeah, that's okay.
Yeah.
And another level is coaches. Now, a
Mhm.
coach is not licensed by the state. Coach is just usually someone who gets certified by a coaching agency. Uh, Out here in California, there's a popular one called CTI, Coaches Training Institute, and so you can go for a weekend and get trained by them, and then you get certified.
Yep.
So those are some of the levels. Then
Yeah.
there are people. I'm sorry,
I
go on.
I have to comment on the coaches too. Now, a lot of the business model for counselors and social workers is even psychologists that do have licenses in Virginia, but sometimes they open coaching practices because the regulations in the state are different for that, and it doesn't mean they're going to be acting unethically, but there are in those instances where the licensed personnel are becoming coaches, they're trying to eschew the more clinical side of it, meaning diagnosing, testing, and things like that, and billing insurance, and just kind of doing a cash business model a little bit differently. And it has different liability things. So you'll see both coaches with degrees and credentials and coaches without. Not saying one's better than the other, but if that seems confusing to you, it's because it's regulations and business practices kind of change.
Yes, and you had mentioned diagnosing and testing. Now, all psychologists don't do diagnose,
Yeah,
diagnosing and testing. For example, I don't use the standard diagnostic manual to do diagnoses. I just diagnose people in terms of their irrational beliefs.
exactly.
Someone is diagnosed as mainly having must number one, a
Mm-hmm.
need for approval and to do well. Others might have must number two, anger, resentment, a demand on others, and others might have must number three, which is a demand on the conditions of one's life, or some people have a combination. So that's the way of REBT diagnosing emotional problems.
Yeah, exactly.
And then
Exactly.
there are people who actually do psychotherapy, defined as we have, helping people with emotional and behavioral problems who don't have any degrees and no training, but
Yep.
they're good at it.
Yep.
They might be born rational and they help other people in that way.
Yep.
So these are the various levels. Is there anything else we left out, Tommy?
Yeah, a couple things. First, I would say yeah, those unlicensed, uncredentialed, uneducated psychotherapists are often really good. So, and they come in the forms of coaches. Sometimes they'll call themselves coaches. Sometimes call themselves psychotherapists. So, kind of do your own research and homework on them, and interview them. We talked about this in an earlier episode as well.
Yeah.
But I
And
wanted to kind of round it out.
sometimes they could just be a friend who
Hey,
helps you.
yeah, sure. In fact, when I used to teach REBT to the inmates at the jail I used to work at, and it kind of became viral in a way there, in which the inmates would take the information I gave them and teach it to their friends and cellmates and podmates, and it would kind of go viral in that way. And none of them had degrees. Some of them, a lot of them didn't have high school diplomas. So, but they were able to get it. They were able to pass the information on and help each other out very effectively. So that's the power of REBT that way. And in fact, all levels that we've talked about so far can do REBT and do it effectively. But lastly, the counselor, and that's me. We are trained in the Department of Education, so we're not in the Department of Psychology or the Department of Social Work. We're in Department of Education because we focus on things like Piaget and Erickson when it comes to developmental models, and that's kind of our focus. So we're not necessarily concerned, even though we're well trained on it, with psychopathology as defined by the DSM and things like that. We're concerned with getting people through the lifespan from infancy to death, essentially. Not essentially, exactly that. And that is our training. And of course, we're focused mainly on Carl Rogers' person-centered approach. That's what we're mainly trained on, even though we're trained on many other theories as well, including REBT. So we kind of have a micro approach to the individuals, but we're also trained on family systems. So we do some MFT stuff too. It kind of all blends together. So in many ways, you can look at the credential and go, oh, okay, and move on with life and see what the person actually does. Are they an REBT therapist? Are they a family systems therapist? Are they CBT, DBT, all the things we've named before? Sometimes that credential at the end of the name doesn't matter so much as their experience and their theoretical focus.
Okay, very good. I think we pretty much covered the gamut here. Anything
Mm-hmm.
else you'd like to add, Tommy?
Yeah. So interesting thing about therapists, doctors, medical doctors, not quite knowing what a psychotherapist is. And I'm actually been finding that some doctors don't know the benefit of behavioral health or what we do to begin with and how it looks. In fact, I've had many nurses and doctors just kind of say it's all Greek to me, and they think we wave a magic wand and these people become behaviorally better. And they treat it that way in many ways when they approach me.
Yeah,
This
that's a good point. I remember a physician once who told me he was feeling stressed, and I said, I'll be happy to help you with that. I'm a clinical psychologist. And he said, oh, yeah, I know what to do. Take a vacation. Don't work so hard.
Oh,
So
geez.
that was his idea of
Yeah, yeah,
dealing with stress on a profound level.
yeah. And that's actually a lesson for folks listening, guys. We've mentioned MDs that do have knowledge about behavioral health, and they've kind of thrown themselves into it. Beck, David Burns, etc. However, there's often those that have no idea the benefits because they don't encounter it, and that's fine. That's not a slam on them. And in fact, this is starting to be addressed in the integrative healthcare model. Now, the integrative healthcare model is a model where a treatment team is formed between their medical doctors and a behavioral health specialist or a team of behavioral health specialists that come together and help an individual person get better on multiple levels. Because let's say a person has a problem with weight, and well, weight is usually a problem with the person's eating behavior, typically speaking, or exercise behavior, or sleeping behavior, if it's not related to some sort of physical problem. So let's say the doctor eliminates all the physical problems. Go, well, okay, so the only thing left here is a behavioral issue. I have a guy that can help you out with it. And hopefully that doctor refers them to a REBT therapist or has an REBT therapist in their clinic. So that way you can have better physical health outcomes through a behavioral health approach. And the health system's really getting better and better at this. There's multiple models and programs within managed care organizations like the insurance agencies, healthcare insurance, that are bringing these models to the field, and we're actually seeing a lot of great outcomes. Less inpatient hospital stays, less emergency room visits, because these people are addressing the underlying behaviors, unhealthy behaviors that are leading to poor health outcomes. Michael.
Yeah, that
Yeah.
sounds very good. Nice innovation that I
Yeah.
wasn't that familiar with myself.
It's taken the world by storm, Michael.
Okay. It's a while before it gets to the West Coast,
Yeah.
perhaps. Well, we'll have another episode very soon. If you enjoyed this one, or you enjoy our episodes, please give us a thumbs up. And if you have comments or questions, uh, send us that below. Suggest subjects if there's anything you'd like us to discuss. And we've got many very good suggestions that we've discussed. Volunteer if you'd like to be on with us with a problem or to help you supervise a client. Donate to Patreon uh, if you'd like to support us. Subscribe to the REBT Advocates to stay on the rational side of life.